Assalamu alaikum, how are you? I hope you all are well. Smoking damages the airways and small air sacs in your lungs. This damage starts soon after someone starts smoking, and lung function continues to worsen as long as the person smokes still. It may take years for the problem to become noticeable enough for lung disease to be diagnosed. Smoke damage in the lungs can lead to serious long-term lung diseases such as COPD, that means chronic obstructive pulmonary disease. Smoking can also increase the risk of lung infections such as pneumonia and tuberculosis, and it can worsen some existing lung diseases such as asthma. COPD, chronic obstructive pulmonary diseases, which is one of the leading causes of death in the United States, includes both chronic bronchitis and emphysema. Chronic obstructive pulmonary disorder, that means COPD, is one of the leading causes of death. It may cause death. In COPD, damage to the small airways in the lungs makes it hard for the lungs to get oxygen to the rest of the body. Smoking is by far the most common cause of COPD. The risk goes up the more you smoke and the longer you smoke. Some of the early signs and symptoms of COPD can include noises in the chest, such as wheezing, ratting, or whistling. Some of the early signs and symptoms of COPD can cause or include noises in the chest, such as wheezing, ratting, shortness of breath when active, and coughing up mucus. Over time, COPD can make it hard to breathe at rest, as well sometimes even when a person is getting oxygen through a mask or nasal tube. COPD tends to get worse over time, especially if a person continues to smoke. There is no cure for COPD, although some medicines might help with symptoms. Chronic bronchitis is a common problem in people who smoke for a long time. In this disease, the airways make too much mucus, forcing the person to try to cough it out. The airways become inflamed, that means swollen, and the cough becomes chronic, that means long-lasting. Chronic means long-lasting. The symptoms can get better at times, but the cough keeps coming back. Over time, the airways can get blocked by scar tissue and mucus, which can lead to emphysema. In emphysema, the walls between the tiny air sacs in the lungs break down, which creates larger but fewer sacs. This lowers the amount of oxygen reaching the blood. Over time, these sacs can break down to the point where a person with emphysema might struggle to get enough air, even when at rest. People with emphysema are at risk for many other problems linked to weak lung function, including pneumonia. In later stages of the disease, patients often need an oxygen mask or tube to help them breathe. Emphysema too cannot be cured, but it can be treated and slowed down if the person stops smoking. So please avoid smoking habits and if possible please stop soon. Have a good day or good night for everyone.